Hello. Let's see today's presentation about pulse point assessment in a nursing and CNA staffs. So, pulse point is used generally for the identification of a circulation in each part of the body. That's the reason we have a 9 points. When we discuss the 9 points, we will discuss each point indicates what. First thing, in introduction, we can see also in a general pulse characteristics, we will see regardless the location, the pulse will be having a four characteristics. The first characteristics is the beats per minute. We want to assess the beats per minute, which will be normal for 60 to 100 beats per minute for adult. In a pediatric, it will be high, and in the adult, in the infant, it is more than the pediatric size, as we all aware of. We will have one more discussion class about this beats per minute. In the next thing, rhythm, we can see a rhythm will be always beats or patterns, we can call it as it will be regular or irregular. One thing, the rhythm will be normally like with a regular time period, and it will be following all the characteristics of um, normal heart rate. Sometimes it will be irregular, it can be any reasons. Maybe the patient is having a dysarrhythmias like atrial fibrillation or atrial flutter, any of such things. Then we can see the strength, that is the amplitude, the forcefulness of the pulse beats. How strong is the pulse? We will be identifying here. It will be indicating as a volume or intensity, strong, bounding, normal, weak, or thready pulse, or the absent. Absent pulse, which will indicate that the patient don't have any kind of pulse at all. It can be a serious thing if the patient don't have a pulse with no heart rate. Then it indicates the patient is not having alive, the heart is not pumping, the circulation is stopped. But if the pulse is stopped in any particular limb, then it indicates there is no circulation occurring in that particular limb. A weak pulse can also indicate because of low blood pressure or low circulation. Sometimes a patient with after anesthesia effect, or a patient who has been had an accident, all these conditions we can see this weak pulse. Symmetrically, the pulse need to be equal and same in left and right side of the body. We can say it needs to balancely present in the equal side. Bilaterally, it needs to be a same potential. It should not be up or down. Now comes to our pulse points with a different sides. Temporal pulse, which will be just next to our earlobe in the side of the head. This will be mostly assessed when the patient is having stroke or head injury. We can find out whether the patient is having a proper circulation in their head, so that this pulse will be helpful. Then comes to the carotid pulse. This pulse is very important in an adult because this is the pulse will be assessed during the emergency. Example, when the patient has a weak or thready pulse, the patient has any kind of cardiac arrest, that moment we will be assessing the main pulse of this place. If this pulse is not there, then it indicates the patient needs a emergency care, where we will start with a CPR for improving the circulation. This pulse will be checked during the CPR, and even if the patient will be found out with any kind of dysarrhythmias. Please note and don't forget, we cannot pressure this pulse to assess more than 10 seconds continuously in one side, or even bilaterally we cannot assess the pulse at the same moments. Then comes to the apical pulse. This pulse is assessed in a fifth intercostal space, and it shows that is the pulse in the whole body is being effective or no. Then comes to the brachial. In a brachial pulse, this one is commonly assessed in a pediatrics and in infants. Always any pulse we will be assessing, we assess with our index and the middle finger, not with a thumb finger or any other fingers, because it can end up giving us a false pulse count of our own. A brachial pulse, radial pulse will always indicate the extremities blood circulation of upper body. And in the radial pulse, it is located just above to the thumb or thumb finger of the human being. So this will indicate how is the circulation. Mostly brachial pulse, radial pulse will be seen if the patient has been had any kind of paresthesia condition in their hands, or even the Broca's disease in the cardiac conditions. These conditions we will do the assessment of brachial and radial pulse. Popliteal, posterior tibial, femoral and dorsalis pedalis. We will assess this one for a lower body circulation of the pulse. Mostly, this pulse indicates whether the person is having any kind of circulatory problem in the lower body. Popliteal pulse, we will be assessing to the person who has had underwent post total knee replacement or any kind of surgery, maybe DVT surgeries to the patient. It is checked just beneath to the knee of the person. Posterior tibial, it is just behind the ankle and in the bony prominence of the person. Mostly we will be checking this one with a diabetic neuropathy or the person who has been facing with a diabetic wound to find out the circulation. And also in a special conditions, whenever the patient has underwent any kind of femoral site surgeries, example the patient underwent cardiac catheterization from the femoral artery, we will be checking this pulse to find out the circulation has been not affected to the patient. And sometimes when we do the patient with a pneumatic cuffs, we will be assessing the pulse to make sure that the circulation is not affected because of the compression stockings. Dorsalis pedalis, also the same reasons. We will check this one on the top of the foot between the first and the second toes. Then comes the last one, femoral pulse. It's a groin area where we will be facing, if we don't find out the carotid pulse in an adult, mostly we will be checking this pulse in an adult, and it's a very important pulse in a human being, the adult persons, where we will be assessing a easy IV access to the patient who has a large volume of transfusion required. So I hope the class was been interested and this video has been effective. Please subscribe and support. Thank you. If any questions or any doubts, kindly comment. If you need any other topics, also please comment. Thank you.